Good morning. It's 11:40 a.m. here on March the 26th. My name is Alan Lewis, and I'm the Fire Chief and Emergency Manager for the City of Virginia. I just wanted to take a moment to update you on what our city and our state and county partners have been doing to help fight the COVID-19 crisis and pandemic that we're currently facing. So as many of you may know, that yesterday Governor Tim Walz issued an executive order called Stay at Home Minnesota. And this directs Minnesotans that are not engaged in essential services to stay at home. This will help slow the spread. It's called flattening the curve, and help us get through this difficult period sooner. So a brief stay at home graphic that I'll just show right now. What we want to do is we want to encourage you to do things like go to the grocery store. We want you to keep your medical appointments through the pharmacy. We want you to take out, do delivery from our nearby restaurants. We want you to be able to walk your dog, ride your bike, be in nature. Remember, in all of these, you want to stay 6 feet apart. We want you to be able to pick up essentials for your neighbors or your loved ones in need of assistance. These are all things that you can do under the stay at home. So it's not a complete isolation, locked in your house 24 hours a day. You do need to get out. You do need to do things. We just want you to maintain social distancing. What we don't want you to do is go to work unless you're providing an essential service. You will know if you're providing an essential service. It is outlined in the governor's declaration. I'll go over that in just a minute. So we don't want you to socialize or gather in large groups. We don't want you to spread this virus. We want you to make sure that you can visit loved ones, but in a way where you're not doing to the hospital or to a nursing home, because some of those nursing homes and hospitals now have some very strict, stringent requirements on what is allowed and who is allowed in there, and that's to protect their patients and care providers. So when Governor Walz issued this order, which will go into effect on Friday the 27th at 11:59 p.m., one of the things that for the exemptions of activities that he did note is that if you need to relocate to safety, if you're in an unsafe situation, that is allowable to be out and about. Health and safety activities, seeking emergency services, that is allowable. Outdoor activities, again, allowable. Getting necessary supplies and services, allowable again. Essential interstate travel, if it's absolutely essential to return home, then that is allowable. Care of others. If you have an elderly parent, you have an elderly neighbor, you're a care provider, that's an essential, that is a reason to be out. Anybody that is displaced or does not have a home to live in isn't subject to this order either. And then any tribal lands and activities may be subject to their own orders, but are not subject to the governor's orders. Some exemptions for people who work in critical sectors. So again, healthcare, providing fire and EMS and police services, providing food and agricultural work. Our grocers, our clerks have been absolutely great through this process. If you work in the energy sector, the water or the wastewater sector, that is an essential service. Public Works is also an essential service. Communication, information technology has been deemed an essential service as well. And then other community-based government functions and essential operations. Critical manufacturing, notably, was included in there, and that does include iron ore mining and processing operations. Just looking back, on March the 24th, the City Council ratified a resolution that was put forth by the mayor in which he declared the City of Virginia to be in a state of emergency. And I just want to talk a little bit about what a state of emergency does and what that allows myself as the Emergency Management Director and our leaders to do. So the reason that this does is this invokes our disaster plan, and it helps us contain and mitigate some of these issues that we're talking about. Right now, it's the spread of this coronavirus. So we do have the ability now under this emergency declaration to suspend certain laws and to modify compliance with those laws, to change some policies. It gives us more flexibility to do what we need to do in order to fight this. And it's necessary to protect the public health. I want to just review. So as of 11:45, there are 5 confirmed cases of the COVID-19 virus in St. Louis County. There has been 2 deaths statewide, and there is currently 287 cases in the entire state of Minnesota. The City of Virginia has responded, and we have classified our employees into essential and non-essential employees. Our essential employees have been contacted and told that they will continue to provide service. I want to assure the residents of the City of Virginia that our critical services will still continue. You will still have your fire, your police, your ambulance. You will still have your power, your light, water, your sewer services, your trash pickup. That is all being considered an essential service. Your mechanics will still be working at the garage. When you think about it, our ambulances, our fire engines absolutely need those to continue to be able to be in service and on the road. So we want to thank those people that aren't seen maybe every day, but assure that our operation continues to run from both the fire and the police side. We want to just encourage you to make sure that you utilize 911 for true emergencies. This is very, very important. We don't want to overwhelm our hospitals. We don't want to overwhelm our EMS systems. So if you do have an emergency, call 911. We will come. But please make sure that it is truly an emergency and that we're utilizing those resources appropriately, because there is a limited amount. Again, what some of our partners are doing in public health is they're monitoring the different outbreak or the different locations of these. They're doing a lot of work. We want to encourage you to contact the Minnesota Department of Health on their website, contact the Centers for Disease Control, get your information from these reliable sources. It seems almost every day we have to counter some of the rumors that are out there, and there's just too many to counter. So please get your information from the Centers for Disease Control, the CDC website, the Minnesota Department of Health, the MDH website. Know that hospitals are enhancing their internal surge capacity. They're building up resources. They're doing things like gathering extra beds, preparing extra staff, trying to secure ventilators. Your local public health departments are working with people who don't have a place to go to secure them housing and places to go to. Emergency managers, I'm in constant communication with the St. Louis County Emergency Manager on a daily basis, as well as multiple other fire chiefs, where we coordinate both at the state, the local, and even the national level. Best practices, how to better protect our people. So there is a lot happening there. Our ambulances are working with Arrowhead EMS in our Region 8 and are coordinating for the delivery of personal protective equipment, and we've seen some great successes in that area. So we can't thank our partners in county government, local government, state government enough. Our long-term care facilities continue to update recommendations for care. They continue to make sure that their patients are best protected, and there's a number of things that we've done to secure that. Thank you once again. Again, stay at home, Minnesota. Please go to the CDC. Please go to the Minnesota Department of Health. I just want to encourage everyone to pull together. We're Americans. We've gone through tough times before. We will get through this together. Thank you.